Bristol Hospital is hosting a free monthly geriatric medicine and dementia educational series. It's being led by my guest this morning, Dr. Margarita Reyes. She joins us once again. Now, keep in mind, the next session is happening Wednesday at Bristol Hospital from noon to 1. And, Doctor, I guess this one is going to focus more specifically on how to do some family planning to look to the future once somebody is diagnosed with dementia. Why is that so important?
It's more difficult to make decisions when a crisis is already happening. And that's why it's important to think and talk about difficult scenarios in advance. While it's good to hope for the best, it's better to be prepared for the worst outcome.
Yes, because this is degenerative. I imagine the challenges probably start to grow as the disease progresses. But what are some of the basic things people can expect, at least in the early stages, to plan for?
You said it, Tim, a decline. It's a neurodegenerative disease by definition, and degeneration means worsening. Needing more and more help as the disease progresses is inevitable, and no one can be a caregiver 24/7. The need for a change in living situation may also arise.
Okay. What is the timeline generally in this situation, or at least what you're going to be talking about Wednesday?
There's a staging tool that we use called the Functional Assessment Staging Test. And this table outlines that the average patient with Alzheimer's disease can battle the dementia for 10 to 15 years. However, every patient is different. For some, the decline may be slower. For others, the decline may be more rapid than we expect.
In the later stages, is it so much the disease, or is it now you start to have to shift towards problems secondary problems that the disease is causing, more catastrophic events like a fall, like is sometimes the case with people who have Parkinson's disease, and then the fall really starts to precipitate a greater decline? Yeah,
so a fall, yes, is a safety issue. So functional independence is always the goal for dementia, but maintaining that independence needs to be balanced with safety. Other safety issues include driving accidents, medication errors, or fire hazards related to leaving the stove on.
Yeah, these are the things you have to start thinking about now. As you said, you never want to try to do this once the crisis is upon you. So, Wednesday, August 8th, noon to 1, right there at Bristol Hospital, 41 Brewster Road. It is free. It is open to everybody. This is just a public service they're doing at Bristol Hospital, led by Dr. Margarita Reyes, who I didn't even say welcome. Hello. Good to see you again, Doctor.
Good to be here.
We'll have you back here for the next installment in that session next month. Still ahead.